Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
You talked about soy milk a few weeks ago. I want to add protein smoothies to add extra protein to my day, not to replace a meal. One, how bad is cow milk for us? I'm in Canada where I think our milk is a bit better than it is in the US. I know it can cause increase in mucus, especially if sick, but I don't have an intolerance to it. I can't get organic cow milk where I'm at, but I can get extra filtered ones if that makes a difference. Should I use cow milk, soy milk, oat milk? And two, is there a good protein powder? Like you did for vitamins, what should I look for in a good protein powder? My husband wants the fun flavor ones, which I'm okay with too. And I know they might not be the best, but it would be a compromise as we would both be using it. So that's for you, Dr. Herkul.
There's a part one, part two there, I think. Okay.
Yeah.
So let's talk about dairy. I would say it's probably in my top three questions I get. I think we get this one over and over about, what can I eat? This food, peanut butter, dairy. Anyways, so here's the details on dairy. Number one, in the Concussion Fix program, we are very specific on not trying to be too restrictive on a whole host of different foods to avoid. So the only two foods, if you could even count sugar as a food to avoid, is sugar. And so that's processed sugar. If it says refined sugar on it, we avoid that. Natural sugars are okay. So that's the first one. The second one is gluten. And so there's a lot of different grains. Obviously wheat has gluten, but even some other grains and some other products like oats can be cross-contaminated. So those are the two that we say 100% do try to avoid. Dairy products, I do mention in the course, and when we re-record, we're going to clarify some of these things, but I do mention is that being more pro-inflammatory for some people that have a sensitivity. And so that's the one food group that is a bit of a gray area. I think there's a lot of benefit to good quality dairy products. For example, fermented kefir or yogurt is great. However, for some people that have food sensitivity, like myself, it is going to be more inflammatory and it can contribute to symptoms. Now, the reason we focus on gluten is because those symptoms are very specific to the neurological system in some cases. With dairy, you don't get that specificity. Usually, as you've already said in your question, there is a connection to things like the mucous membranes getting inflamed or irritated or increased mucus production. So that can be in the throat, that can be in the sinuses, that can be in the intestinal tract. It can also present like gas and bloating and changes in stools. That's probably the most common one. And then thirdly, it can influence other things in the body, like being more achy and maybe a little bit more joint pain, maybe even more neck pain. So it's one of those things that I ask people do you think you have a food sensitivity? Has your doctor tested you for lactose intolerance? Lactose intolerance is not what we're talking about. That is an intolerance. You can't break down that sugar, which is what lactose is. But what we're talking about here is an inflammatory allergic response. So I think we're leaving it up to the member of themselves to determine if there is a food sensitivity, then you should avoid it. And if it's not, then maybe you can include it. And whether or not it's organic, you do your best. You're trying to find sources that are going to be ideally the lowest in contamination and the highest in nutrients. In Canada, in general, dairy milk does not contain a lot of the growth hormone that the US dairy milk does, and most dairy cows are at least partially grass-fed too. So if you can't find organic, that's okay. Final comment about dairy is that there's different tiers of dairy in my opinion. So something like pizza and cheese that's been fried is not nearly as beneficial as, let's say, yogurt or kefir or something fermented. Some cheeses are okay because they have a lower level of some of these more inflammatory proteins like casein. But definitely the more processed versions of those cheeses and things like whipped creams and ice creams where you're mixing in with sugar, those things are to be avoided. Also, people notice if they have a glass of milk versus a little bit of decent quality cheese, like feta, for example, they're not nearly as symptomatic, or maybe not symptomatic at all. So I think there is definitely some differences in the forms of dairy, not just the quality, but also the type. So that was part one. Part two.
Just to stay on that,
Yeah.
because they mentioned about like extra filter. Is there because I know when I go to the grocery store, you can see different like filters almost of
Yes,
milk.
yeah.
I know the True Taste, I think, is more filtered, or
It's like
I
3 or 4 times filter they advertise, right?
yeah.
Yeah.
Do you know if that makes a difference? I'm assuming since they put that in there for that.
It's more so like a taste thing, honestly, Nikki.
Okay.
It's like not so much. It's not so much an issue with it being higher quality or somehow it filters out any sort of additional
Okay.
contaminants. I don't think that's the case. I think it's more so like a marketing taste piece. So I don't think that's as important. Organic is definitely, I think, a cut above. If you can find like totally grass-fed cows, that's definitely a cut above. Like right now, milk is still being produced, and they're eating hay, and they might be eating some corn as well. But generally they're grass-fed. And then finally, we don't know if there are hormones added to them in terms of antibiotics. Sorry, not hormones, but antibiotics, because there might be infections. So that is something that organic milk is lower in. And then there's this thing called A2 milk. I don't know if people have heard of this before, but this is a type of milk a type of cow that produces milk that is lower in a specific, more inflammatory protein that's found in dairy. And just about the fact that there is this company that's creating this, that's actually pretty widespread, tells us that they know that dairy is inflammatory and allergic for a lot of people. So it's not like a secret anymore that it's only naturopaths talking about this. I do want to. I know it's a bit of a longer question, so it's a bit of a longer-winded answer. I do want to talk about just some of the dairy alternatives. So things like soy milk, coconut milk, rice milk, oat milk. I think that there are lots out there. I would just caution people of being careful of just consuming lots of these other nut milks and dairy alternatives, because you can also be sensitive to soy. It's a common food allergen. You can also be sensitive to almonds and even oats. And oats in general are pretty high in sugar. A lot of these milks do have an unsweetened version of it. So that's the one you want to be looking for. If it has things like vanilla, if it has any sort of like more flavors to it, you'll look at the label panel on the back, and it will say it contains 7 to 10 grams of sugar, and that sometimes is added. Oats in general have a higher content of sugar, even if sugar isn't added, it's naturally occurring. And some people do have blood sugar spikes with oats. So I don't have one preference on this. I think it's more so like finding one that, number one, agrees with you, and number two, is going to be really low in sugar. And then the other big thing is like alternate. Don't just stick with one and drinking glasses of it. I'm not opposed to something like organic soy milk. Or even gluten-free organic oat milk. I think that's fine. Coconut milk is fine. But if you're just drinking a lot of that, you can develop a sensitivity to that. And then finally, the protein powder part of that question. If you can tolerate dairy, grass-fed whey protein there's tons of good evidence on it. I just read a paper on saying that the amino acid components found in whey protein increase something called glutathione, which is one of the key antioxidants and anti-inflammatory substances. And the paper was talking about its possible benefit in supporting brain health after a concussion. And so there is that benefit to having adequate protein. So if you can handle dairy, you can handle whey, find a really good quality whey. The extra flavors, you don't want anything artificial. You don't want any added sugar. You look for kind of a whey isolate or a really good quality combination of isolate and concentrate. And so those are your best options. If you can't do dairy, then you have some plant-based options. And usually it's a mix of some sort of pea and rice and maybe quinoa and a couple other things like hemp. The flavor isn't as good for most people, and there's usually some added vanilla or chocolate. Again, those things are okay if there isn't a lot of added sugar. And again, some people are sensitive to pea protein. So Ideally, we get everything from our diets. However, I do think at kind of augmenting your diet with a protein powder that doesn't replace meals, but also just more augments them. It can be blended into a smoothie, like something like with blueberries. Really great way of getting those antioxidants and protein.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.